Hello and welcome to the Department of Neurosurgery Preoperative Spinal Seminar. My name is Kate. I will be narrating this seminar. Before we begin, please don't feel as though you need to be writing everything down, as this document may be printed and most of this information will be contained in your discharge instructions. Let's begin. We tell patients they are allowed to shower on post-op day 4. There is no direct water pressure on your incision, but your incision is allowed to get wet. You can shower as you normally would, shampoo your hair. The water, the shampoo, and whatnot is allowed to run over your incision. When you get out, you pat your incision dry and then leave it open to air. So we are not recovering our incisions once we remove that dressing on post-op day 3. Some of you may leave the hospital with your incision open to air or with glue, and again, the post-op care is the same. You shower. When you come out of the shower, you pat it dry and you leave it alone. For anyone that goes home with steri-strips, we tell patients that they are allowed to remove those steri-strips between post-op day 10 to 14. I tell patients the easiest way to do it is coming out of the shower when the strips are wet. You can go ahead and gently remove them, but again, this is not done until post-op day 10 or day 12. If you have any questions in regards to this, or you are unsure, you may call the office. But I do tell patients to keep in mind when they come in for their post-op incision, those incisions should be open to air, free of steri-strips, no dressings, no bandages. And just a quick reminder, the Hibiclens is not to be used post-operatively. And for anyone who may be traveling or for anybody who is a fan of bathtubs or hot tubs, we are not allowed to submerge your incision for at least 3 to 4 weeks post-operatively. So just keep in mind, no tubs, pools, hot tubs, whirlpools, or things of that nature. Once you are home, I tell patients, nutrition-wise, you should do your best to make sure that you're including protein in your diet, as it will help your healing process, that a colorful diet is a healthy diet. And for my cervical patients, my neck surgery patients, some of you may go home with difficulty swallowing or sore throats. So I do tell patients preoperatively, prior to coming in, when you do your grocery shopping, you should be thinking about picking up food items such as yogurt, ice cream, soup, things that would be soft or easy to swallow. And as far as your exercise is concerned, we encourage people to be up during the day, trying to maintain as much of a normal day as possible. I tell patients to try to be up out of the chair at least once an hour. You should begin walking on flat surfaces before you do attempt any type of an incline. In regards to walking, just make sure that you are gradually increasing your distance. Once you are home, I tell patients you will sleep better in your own bed. It is usually not necessary to rearrange your house or to bring your bed downstairs. I tell patients if you're climbing stairs before surgery, you will likely be climbing stairs after surgery. It may be a little bit slower, but it is safe to climb stairs. I generally tell patients, come down over the stairs in the morning and try to spend your day on the lower level or on your first level, and you can usually climb the stairs at the end of the day to retire to bed. But most patients sleep better in their own bed. Also, sometimes people do complain of difficulty falling asleep, and I do tell patients that the use of Benadryl or Tylenol PM is not prohibited unless it's otherwise contraindicated. Both of these items are sold over the counter, but may in fact help with your sleeping. Patients are always anxious to know about driving and when they can get back in the car. I generally tell people it may be a week or two before you're comfortable behind the wheel, but safety first. Off your narcotics, and please make sure that you are comfortable behind the wheel and have your full range of motion prior to driving. Things to be remembering. Many of you will be going home on narcotics, and narcotics lead to constipation. Surgery often leads to constipation. Before you come in for surgery, pick up items, whether it be Colace, Miralax, Senna. Have something in your home for your bowels so that when you come home from surgery, you have something available to you in the house that you can start taking right away so that your bowel pattern will remain normal. Narcotics and anesthesia slow your bowels down, so it is very important to stay hydrated and to keep an eye on your bowels post-operatively. For anyone who is coming into us with slow bowels, I encourage you to take something maybe 3 or 4 days prior to surgery so that you're having a good, healthy bowel movement coming in to us preoperatively. If there are problems after surgery, such as new weakness or numbness, worsening pain that's not relieved by your pain medication, nausea and vomiting that doesn't go away, difficulties with your bowels, changes in your incisions, please call the office with any questions and/or concerns. You will be starting with your surgeon's office, speaking to either the nurse practitioner or the physician's assistants. If there is an issue on weekends or holidays or in the evening hours, we do offer an on-call number, which will be listed in everybody's discharge paperwork. You would ask for the neurosurgery covering or whoever is on call for neurosurgery. Please keep in mind that orthopedics does cover us 2 weeks out of the month, so it's perfectly fine to speak to somebody from orthopedics and they will triage your call. A couple of reminders in regards to your pain medication and refills. We generally send people home with a week's worth of pain medication, and again, you need to call us if there is a need for a refill. Keep in mind that some of you may get some reminder pain after surgery, and this is normal. The pain can sometimes take a little while to decrease. There is postoperative swelling. It does take the nerves sometimes a while to recover as well. So please be patient. And as a reminder, the use of NSAIDs for our fusion patients is prohibited. Again, our fusion patients are not allowed to take NSAIDs for 3 months postoperatively. For anyone who's not on Patient Gateway, we do encourage you to sign up. It's a great way to communicate with your team. Just some last words of encouragement. It's okay to be nervous. You're having major surgery, and some of you may be scared or worried. We are here to help you and to guide you, to answer any questions that you may have. I will do my best to come by to see you and say hello post-operatively and assist with the discharge process. But again, if you do have any concerns in regards to this seminar, you may reach out to me via Patient Gateway. My name is Kate Hill, Hill, or I can be reached via email at khill@bwh.harvard.edu. Thank you for participating in this seminar, and I look forward to meeting you post-operatively. Take care.